Dear Mr. Chairman, thank you very much. First of all, I would like to thank the organizers, Beat Löffler and Petra Kunzinger, for giving me the opportunity to speak here, and congratulations to both of them. I think they're doing a tremendous good job increasing the number of participants in CLINAM and bringing together all the stakeholders from a different point of view in research. Now, what I would like to introduce now in the next 10 minutes is target delivery with magnetic nanoparticles. You might know nanoparticles, especially magnetic nanoparticles, are already used in medicine for biomagnetic cell separation and contrast agent in MRI. For me, I'm personally, you mentioned before, Mr. Chairman, that you are seeking for partners. I am a physician actually, and I'm always interested in being involved in new development, so therefore maybe we can discuss afterwards. But I would like to introduce you now to our system. What are we doing? We do synthesize nanoparticles in our own group. Then we do characterize them. We do address nanotoxicology. There's a poster from Dr. Janko, poster 72, where she is explaining. I will come afterwards to that. And we also do test our particles in biological mechanisms prior to preclinical evaluation in animals. And we are lucky because we do have also a GMP facility in our university hospital. This is due to the fact that the university hospital did invest a tremendous amount of money in implementing this GMP facility because they produce their own pharmaceuticals for their own patients there. And we are lucky because we can use this facility to produce our nanoparticles in a GMP standard. This is important and pivotal to go into clinical trials. Now, synthesis, as I mentioned, we do develop, we do have 4 to 5 colleagues, pharmacists and chemists, who do synthesizing nanoparticles, and the goal is that we do bind chemotherapeutic agent at this point to nanoparticles to attract them with external magnetic fields in certain body compartments. These particles were tested and they are stable in blood, for example, new development, lauric acid with bovine serum albumin, and they don't lose after 24 hours, for example, their facility. So therefore, we did publish this last year, if you do have raw particles like here, and if you do coat them, then you have very stable particles, and then on these particles functionalized with fatty acid, we do add chemotherapeutic agent, this term mitoxantrone. Yes, as I mentioned, this is important to have a GMP facility. We are working together. Here's a co-worker of mine synthesizing these particles in a GMP manner. And, but this is only one part of the mosaic and the circle I showed you before. Nanotoxicology is a big issue. We were aware about this. Scott McNeil, one of the big nanotoxicologists worldwide, and he's the first who did address this really, and also implementing protocols to investigate these nanotoxicology issues. And what we are doing is that we do want to see how toxic are our particles. As you all know, if you do have particles, they may cause in cells oxidative stress. They do interact with the membrane of the cells, and they do cause also cytotoxicity, always dependent on the substance you are applicating, and of course about independence from the concentration. And due to the fact that iron oxide nanoparticles are black, you can't use normal assays already established to investigate the toxicological outcome, because they have a clear interference due to the color of the particles. So therefore we do implement new strategies to investigate the toxicity of these particles, for example with flow cytometry, as I mentioned before, the poster 72 from, oh, sorry, this has now happened what I didn't want to have. Sorry. No, sorry, yeah. Dr. Janko is implementing poster 72, as I mentioned before, because with this we can investigate different types of apoptosis and necrosis factors caused by nanoparticles. On the other side, very important to go into clinical trials is preclinical evaluation. We are lucky because we have our own operation theater with an X-ray machinery. It's a normal X-ray angiography machinery, which is also used for cardiac intervention or in radiology. And we do have here our external magnetic field. We do use concentrate particles in a certain position in the body, in the region of interest. And I would like to show you one main column of our application is, of course, oncology. But we do also address cardiovascular diseases, but because cardiovascular diseases are much more common than oncology, so therefore these are the both big causes for death in Europe and in worldwide. And we also address with magnetic nanoparticle regenerative medicine. I would like to give you now some certain examples how we do this. In oncology, as I mentioned before, we do synthesize the particles, we do inject them into tumor-bearing animals at the moment, and we do have animals who have cancer in the left hind or in the hind limb, and we do inject them intraarterially and concentrate it with an external magnetic field. What we gain in this, I would like to show you. If some patient is suffering from cancer and is receiving intravenous chemotherapeutic agent, what will happen? If you receive the regular dose, it's here mentioned 100%, that means 100% mitochondrion, for example. What will be arriving in the tumor? You see here, this is an investigation in 8 animals. We did inject them intravenously, the regular systemic application way, and you see here, this is the brown sign here, less than 1% of the chemotherapeutic agent which is applied systemically is arriving into tumor region, most of them in liver and kidneys. And if you do our approach, that means magnetic drug targeting, you see here, the 4th column, that from after 24 hours, 57% of the detectable chemotherapeutic agent is detectable in the tumor region, you see here. And of course, we do have also some biodistribution in liver and kidneys, but the fact is that with our application, we use only 10% of the regular systemic dose, and we do reach 57% of detectable chemotherapeutic agent in the tumor region. Tumor region defined as tumor plus minus 1 centimeter. This is comparable to the particles, so the particles and the chemotherapeutic agent, here the particles, are concentrated in the tumor region. And of course, this is a biodistribution. We did publish this last year in Nanomedicine. This is the worldwide largest study concerning the application of magnetic nanoparticles in preclinical trials. And you see here that we have in 30 tumor-bearing animals with only 5 or 10% of the regular systemic dose, in 30% of all the animals in complete and permanent tumor remission. This is a very successful result, and we are working on this to translate this into clinical trials in human. As I mentioned, I do want to translate it into clinical trials, and one part is particles, having a GMP synthesis. The other thing is to have the facility and the infrastructure to apply these particles in a clinical manner. And we did, for this reason, the application in TORSI, that means in people who have died due to any reason, to offer their body for scientific investigation. And together with the anatomical department in Langen, we tried to apply in a simulation method the application of these particles in breast cancer, for example. So here's the anatomy of the breast and the chest in this case. And what you're seeing here, this is the female donor. We did investigate now the right femoral artery to place the catheter. And what we did here, then over the brachial artery, we did concentrate the particles. We mimic here in the middle portion of the breast in cancer. We mimic this, and we said in this part might be in cancer, and we did apply our external magnetic field, did inject the particles through the artery. We did mimic also the physiological flow, because it's a dead person, of course, but we did mimic the physiological flow, and what we reached is then a concentration of the particles beneath the external magnetic field. You see it here, this is the MRI, and these are the histomorphological results. So the one thing is GMP production of nanoparticles, of course, is very important, non-toxic. On the other side, the application mode of our promiseful magnetic drug targeting. On the other side, as I mentioned before, cardiovascular diseases is also a topic we were addressing. If you have a quick look in your bag, you can see in the European Journal of Nanomedicine 2014 that we publish here a about cardiovascular therapy through nanotechnology. What we are doing, you know that plaques are developing in people according often to the age. And this is here a stenosis here in the common artery, common carotid artery. And if you see this here in histological investigation, this is very harmful to the people because, first of all, the risk of stroke is very high, and normally operation has to be done. But as I mentioned before, often elderly people are suffering from these plaques, and operation procedures are all is a big issue for these people. So therefore, we have to find some moderate therapeutic models. So we try now to do this with our application. It means synthesis of specific nanoparticles bound to respective agents to treat, first of all, or to test them in ex vivo accumulation models, and of course then in animal models to transfer this drug targeting model via magnetic nanoparticles into these cardiovascular diseases. On the other side, this is the last point, regenerative medicine. As you might know, many people are suffering from vascular diseases, for example. If you want to overcome this problem, you place into these people via surgery scaffolds. These are foreign bodies, and they do have, in dependence on the location of the body, the tendency to occlude, and we try now to biocompatible these scaffolds due to the fact that we do incorporate nanoparticles into endothelial cells and do then concentrate them in these scaffolds to receive afterwards biocompatible scaffolds. This is the third big task of our research: oncology, cardiovascular, and regenerative medicine via iron oxide nanoparticles. And what I wanted to show you in these 10 minutes is that we do have really the aim to go from bench to bedside with all the facilities we do have. We do application oncology, and we do use also hyperthermia. You can see the poster from Dr. Lühr, number 88. There we do also include hyperthermia as an additional factor for local chemotherapy, because the increase via hyperthermia will increase also the effect of the tumor therapy, and of course regenerative medicine. I would like to thank all the funders of our research, because as is visible in all the talks, to go into clinical trials is very expensive, so therefore we're asking for money, and of course this is one part of the medal, but the other part of the medal is my team, because without my team I couldn't do the work, and I'm very thankful to have them. Thank you very much.
Thank you very much. Thank you very much for the excellent presentation, and very nicely in time. And now the next speaker is